Study: Tocilizumab linked to lower death risk in critically ill COVID-19 patients. Researchers from the University of Michigan have found that critically ill coronavirus patients who were given a single dose of tocilizumab had a 45% lower risk of dying among patients on ventilators. Their paper was published on July 11 in the peer-reviewed journal Clinical Infectious Diseases. The researchers detailed how many of the patients were also more likely to be discharged from hospital or taken off their ventilator a month after treatment compared to patients who weren't given tocilizumab. The drug tocilizumab was initially created to treat rheumatoid arthritis and systemic juvenile idiopathic arthritis, but it has already been repurposed to target the cytokine storms cancer patients have while receiving advanced immunotherapy treatment. Doctors have observed coronavirus patients developing cytokine storms as their immune system overreacts to the virus. The new study suggests that patients may benefit from efforts to target the cytokine storm, as coronavirus patients who received the drug intravenously had a lower risk of death, even if they were twice as likely to develop additional infections. The researchers studied data from 154 critically ill coronavirus patients at Michigan Medicine through late May. Around half of the patients were given tocilizumab, with most receiving the drug within 24 hours of their intubation. Epidemiologist Emily Somers, the lead author of the study, said her team was unsure if there would be any effects associated with tocilizumab in critically ill coronavirus patients. She said, "One role of epidemiology is to rigorously evaluate real-world data on treatment effects, especially when evidence from clinical trials is not available." Their study was an observational one, which means clinical trials would still be required to truly prove that tocilizumab can benefit coronavirus patients. Sommer explained that her team kept trying to prove themselves wrong as signals of benefit emerged in the data. However, it was clear that there was a pronounced difference in mortality despite the increase in secondary infection, even after accounting for many other factors. Some of the study's authors belong to the Michigan Medicine Antimicrobial Stewardship Program, which identified the drug in COVID-19 treatment guidelines in March as a potential beneficial therapy for the critically ill. They recommended a dose of 8 mg per kilogram, but also mentioned that there were risks involved, which means not all physicians chose to use it on their patients.